Welcome back to the Daily Drum on WHUR and Sirius XM, Channel 141. This is the Insight segment. I'm Harold Fisher. This is a Wellness Wednesday conversation, and tonight we will be shining the light on heart disease among Black women. Did you know that Black women are disproportionately affected by cardiovascular disease, certainly facing higher risks, while also sometimes receiving inadequate care? Well, tonight we will explore the unique factors contributing to this health crisis, from systemic inequalities to lifestyle challenges. My guests know this issue all too well, from working tirelessly to improve outcomes to surviving a massive heart attack. Joining me to talk about this are Dr. Yolanda Lewis-Ragland, a double board certified pediatrician and wellness expert. She is also the founder and CEO of Dr. Yolanda Cares Foundation Incorporated. Also, Dr. Paul Underwood, cardiologist, chair of the Association of Black Cardiologists and vice chair of the Open My Heart Foundation, and Dr. Florence Champagne, chair and CEO of the Open My Heart Foundation. I am in good intellectual company. I'm the only one here without an advanced degree, but I hope that I will be able to stand up and provide, some stimulating conversation here. Thank you all for joining this conversation. First and foremost, I want to share just a few fast facts about this issue. Certainly, cardiovascular disease is the number one killer for all Black women, but they also experience the highest burden, with more than 50,000 Black women dying every year. Some 59% of Black women ages 20 and over are living with some form of cardiovascular disease, and Black women have the highest prevalence of high blood pressure. Only 25% of them have their blood pressure under control. I want to talk about these numbers. So let me first start with you, Dr. Underwood. Black women have known these numbers, if not the exact numbers, but they also are just familiar with this issue. Why do you suppose that things have not improved?
Well, I think it's largely multifactorial, and you are very correct, Harold, that we've known about these risk factors for many years. We've been tracking blood pressure, and we look both at blood pressure awareness, so people knowing that they have high blood pressure, people actually taking treatment, so actually actively taking treatment, and then control. And it always has come down to control, that even if we know that we have high blood pressure and we're treating it, we may not be treating it hard enough to get to control. And it's usually multifactorial. Some of it is what we would call clinical, say the medicine isn't strong enough. But the other part are non-clinical factors or lifestyle type factors that relate to this as well. And some of these may be diet and exercise. What we've seen most recently is that obesity is an independent risk factor of cardiovascular disease, and obesity and high blood pressure run together as well. And as more people are becoming obese, and not necessarily in a fashion sense, but certainly in a medical sense, that raises the risk as well. And 4 out of 5 Black women are characterized as being obese. So you can see that this is a major problem coming at multiple angles, but the overall effect is the same. As you mentioned earlier, Black women have the highest degree of high blood pressure. Now, there are more hypertensive Black women than there are Black men, largely because there are more Black women than there are Black men. And this is something that definitely needs to be controlled.
Dr. Champagne, you've been on this program several times before, and you had a heart attack in 2012. First and foremost, I want to ask you, how are you feeling?
Oh, I'm feeling fine today. Thank you for asking.
Mm-hmm. Now, wait a minute. You said you're feeling fine today. Does that suggest that you're not always feeling fine?
No, I am on. I'm being controlled with my high blood pressure, and I'm under the doctor's care. and I make sure that I keep my stress level down. As you know, we have an upcoming event that could be stressful in a good way. But yes, I'm feeling fine today.
So, with that said, feeling fine today, and I'm glad that you are. When you think back about some of the numbers that I just shared, what are your thoughts about it, considering you have a unique position in this conversation?
Well, I do manage my diet and exercise. And he's right when, I never thought about obesity, but I was considered obese. I have been on a program to lose weight, but it is a big factor and lifestyle changes. And I try to educate my family as well as myself on more of a plant-based diet and reducing the level of stress that we experience. And he didn't mention it, but we all know that it's partly hereditary as well. I do have heart disease that runs in my family as well. So I'm constantly alerting my family, educating myself, as well as others as I do support groups about some of the risk factors and lifestyle changes that needs to happen.
hmm Dr. Yolanda, you are a pediatrician, and so I would imagine at first blush from an outsider, why does she care about, heart disease in Black women? But then you look in the mirror and there you go. I would imagine that some of the conversations that you are having are not with your patients, but with your patients' parents.
So I'm glad this is the question you asked, or you framed it that way. When I first became very active in talking about heart disease, I did get a few raised eyebrows. Like, heart disease is sort of an adult, a midlife crisis, if you will, episode. But I beg to differ, and I got very active for many reasons. The first is I'll never forget the most motivating statistic I had heard was that American Heart Association said that 49% of African American women have heart disease by age 20, some sort of heart disease. My question is, by 20, if that's when heart disease happens, then we obviously are seeing it before age 20, but before age 20, it's happening in the pediatric stages, right? The other thing is, people don't know, there's a couple of other reasons that I've attacked heart disease for pediatrics. For Black women, maternal health, right? Cardiovascular disease is the number one cause of maternal deaths. It is the leading cause for maternity deaths, maternal deaths, and we have 3 times as higher risk for having these deaths than our white counterparts. And then cardiac, what do we call them? Cardiovascular heart defects basically are the number one birth defects. And there's a long-term care. So this really does hit the pediatric community. And the problem is we don't start talking about it until the symptoms and the signs show up. And we all know, we call hypertension the silent killer, because you can have hypertension with no signs or symptoms until they're irreversible and they sort of show up. And then, as Dr. Underwood said, now we have to start getting treated, and that treatment can be for the rest of your life. I'm trying to talk about the prevention, which he spoke of very well. We talk about diet, we talk about exercise. The earlier we talk about your habits and the foods that you're eating, and as Dr. Champagne said, if we know this is a part of your heredity, this is in your genes, then we need to attack it early. And guess what? Obesity, if we attack it before, that's why my other specialty is childhood obesity. If we attack it before age 8, then we have much less likelihood that there'll be an adult that is dealing with obesity. So there's so many more reasons to have this conversation for pediatric and youth than meets the eye when we're talking about these signs and symptoms.
Before we drill down a little bit deeper as it relates to some of the health things, I did want to give both of you an opportunity to kind of chat about some of the upcoming events that you have. Dr. Champagne, briefly explain to me what you're working on, and then Dr. Yolanda, you as well, please.
Sure. On Friday, February 21st, We have partnered with the University of Maryland Capital Region Medical Center, where we will be hosting a health equity symposium. And that is dealing with health, justice, and equity in treatment. And so we will be addressing that due to the changes in the landscape of the health diverse in the diversity and equity space, what we can do and some of the challenges that are down the road as far as accessing care and equality in treatment.
And for those who are interested in participating in that, how might they find information on that?
Sure, they can go to the openmyheartfoundation.org. And then it's very important to have that educational component with some of the medical professionals at the hospital level, with Dr. Underwood, the cardiologist, from the social work perspective, the whole person perspective, and we have a legislative perspective as well, what could be done. And then on that Saturday, February 22nd, is our signature event, our 10th year anniversary. We're having the All Red Gala Awards, where we're honoring heart survivors and those that are giving back to the heart health community, such as Dr. Yolanda, and she is one of our honorees. And this, we are just celebrating 10 years of grace. You know, it's only by the grace of God that I'm still here to talk about it today. So we're giving honor where honor is due with the recognition of the ceremony that we're having.
And Dr. Yolanda?
Yeah, briefly, I have similar to Dr. Champagne. I do an annual event. My annual event is called the Red Carpet Affair. Really encouraging whole families to come out. And so what I love about it is in Southeast DC, it's at the Black Box Theater at the Arc. It'll be February 22nd from 5 to 8 p.m. Tickets are free through Eventbrite, or you can go to Dr. Yolanda Cares Foundation or dryolandacares.com and get a ticket. But what we do is we have youth involved in that education. We have Southeast Tennyson Learning Center. Kids do a fashion show. They're fabulous. But throughout the event, we call it edutainment. We're educating and entertaining at the same time. So they're holding up heart health facts. We're giving information about nutrition. It's free. They get free food. They get prizes. We always honor a heart health champion. Last year, we actually honored Dr. Champagne as well. We're honoring Representative Jasmine Crockett for a lot of the work she does with health access, equity, diversity. And one of the conversations that we have is with a young lady who's 29 years old. Her name is Judith Mabone. She was a Miss District of Columbia a couple of years ago, but she experienced between the ages of 16 and 18 years, she experienced 6 heart attacks. This was not an obese young woman. She's a Black woman. She's not an obese. She was an athlete. She was running at the time, doing a 10-mile marathon at the time. And at about mile 3, her heart, she started feeling this tightness in her chest. And mile 5, she was like, I think I need to stop. She was having her first heart attack, and that was at age 16. And between 16 and 18, she had 6 of these. She was eventually treated. They found out her heart was spasming, and it was not a common thing in terms of why she was having them. But this information, again, I just want people to know this can happen to just about anyone. You need to know the signs and symptoms. We also are doing a CPR awareness as a part of this, because CPR in those first few minutes, if you know to get into that chest and just pump on it and get that blood pumping, it can save lives. And because we are in an area like Southeast DC, sometimes the ambulance response time is not the greatest, right? So we want our communities to be aware of what they can control. So that's our event.
Well, thank you both for that information. I have so much more to talk to all of you about, but first we need to take a break, and we remind our listeners that you can hear this and every edition of the Daily Drum Inside segment via podcast on our website, WHUR.com. The original Quiet Storm with Raheem Devon is next on WHUR. I'm Harold Fisher. This conversation continues on Sirius XM channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM Channel 141. I'm Harold Fisher. We continue our conversation about heart health and heart disease with Dr. Yolanda Lewis-Ragland, Dr. Paul Underwood, and Dr. Florence Champagne. I want to do a little more drilling down and allow me to ask some of the questions, Dr. Underwood, that a lot of patients who may be new to this difficult space would ask, because already we've spoken about some of the contributing factors and so I guess I'm trying to understand if this is hereditary in some cases.
Sorry.
Dr. Underwood, can anything be done about this issue if it's hereditary?
Well, certainly we've learned a lot more as time has gone on. And if you can recall, or probably you can't recall, say back in the 60s when barely aspirin was being used to treat heart attacks. Now we understand them much better. And so when someone is in the throes of a heart attack, you can often get the artery open, right? And then to get blood restored to it. Now what happens is that we just need to make sure that they don't have another heart attack. And this is where a lot of the advances have been made. Even though there may be a genetic component to this, we understand that a lot of the processes are just what we said. We said high blood pressure, cholesterol, and diabetes. So certainly controlling the blood pressure, controlling the blood sugar is important. But we also see that we can make tremendous roads toward preventing cardiac events by keeping the cholesterol very low. And so focusing on something like the LDL cholesterol and really having some of the newer medications, not all of them are statins like they used to be in the past. They're newer medications that do an excellent job of lowering the LDL to the point that you really can't produce the plaque that's going to then rupture and cause a heart attack. So I think that there's been a new focus on risk factor modification that wasn't there before. And that should hopefully overcome some of this influence of heredity that's there. Mm-hmm. As Dr. Yolanda stated, if you know that this is in your family, then you can anticipate it, that it's coming. And so you can watch out for it and be prepared if it does show up. And that's what we want people to do, is to catch it on the front end, as opposed to waiting for some sort of event such as a stroke, heart attack, heart failure on the back end and playing catch up for the rest of your life.
But can you also share some thoughts about what Dr. Yolanda was saying about Judith Mabone? Because if an athletic 16-year-old can have a heart attack, I mean, to be quite honest, that's just really scary because that really flies in the face of obesity, poor diet, lack of exercise, etc., etc. So is that? She said it is rare, but based on her description of this young lady at the time of her first heart attack, there just seems to be something else going on there.
Well, right, absolutely. So as you well know, there are no absolutes, right? And so for this young lady, she had a heart attack, but as Dr. Yolanda said, it wasn't from atherosclerosis. It wasn't from cholesterol buildup. She said it was from spasm, right? So about 5% of people having heart attacks don't actually have plaque. They have other reasons. Maybe they had a blood clot that went, or in this particular case, she had spasms. So it's a different issue than what is killing most Americans now. Most Americans now are dying because cholesterol builds up in their arteries and then the arteries close off. That is not what this young lady's problem was, but it underscores the importance of knowing what cardiac symptoms are, because young people can have heart issues and we don't want to miss them, because it can be catastrophic. And I'm sure you've seen a lot of athletes who have succumbed while they've been playing their sport based on heart problems. Pediatric heart disease is a different category. What we're talking about is atherosclerotic heart disease or hardening of the arteries. Mm-hmm. And that's from cholesterol and these risk factors that I spoke of over a period of time. So diabetes, high blood pressure, and the high cholesterol. smoking is another important risk factor.
So glad you said that because of young people and smoking. I just want to make sure you put that out there because there's a lot of smoking going on. And I have to talk to the young people all the time. If you're depriving your heart of this oxygen, it's very likely that your heart will stop pumping because you yourself are depriving it of this oxygen. So I am glad that you actually mentioned the smoking because sometimes we don't, and it's become so commonplace. It's not just cigarettes, obviously, right? So there's so many other substances now that are being smoked and it's causing anoxia and it is affecting the heart. So I'm glad you brought that up.
Yeah, I was about to say that as it relates to the issue of smoking, this isn't just about cigarettes. This is about people who are smoking weed. This is about people who are vaping, I would imagine, as well. And sorry, fellas, but I would also imagine, and some ladies too, that cigars contribute. And you're speaking to someone who smoked cigarettes for 20 years before quitting in 2001. And so, that is a reality. Dr. Champagne, I did want to ask you about something that you said earlier in the conversation. You said prior to your heart attack in 2012, you did not really consider some of the messaging regarding obesity and the like. You were in that number of women who were either not getting the message, you were ignoring the message, or just not understanding the message. Is that accurate?
Yes, that is accurate. In our busy lives, in our busy world, we just keep going and going. And I was just one of those people as a social worker, as the director of social work in nursing home facilities and things like that. I've always had a lot of patients to assess, do care plans for. So caring for myself was something that I just did not focus too much on. I would eat on the run. It wasn't until a nurse actually stopped me and said, "Look how swollen your ankles are." And I looked down and I still felt like, "Oh, I'm fine." She's like, "No, you need to sit down. Let me take your blood pressure." Even with that, she insisted that I go to the hospital immediately because of how high my blood pressure was. And it's like, I just want to say I'm a prime example of not really looking for or paying attention to any signs or symptoms because we are so busy in our lives, even when we're told. But it's not until something hits you, like a heart attack, that you begin to really focus and pay attention. And I had a lot of questions. How did this happen to me? Why did this happen to me? But looking back, I saw the signs. I did see the signs and the symptoms.
On the day that it happened, did you know that you were having a heart attack?
No, I did not. And let me just say that leading up to that event, I would experience a sensation in my jaw. I would have lower back pain. It was never a crushing chest pain like so many of the other people describe or that's been reported as descriptions. So I thought the symptoms were vague. And I was a poor historian. I didn't really explain exactly what was going on with my body. Each time I went to the ER. So I was sent home and I was diagnosed with stress, or, I was told to seek counseling or anxiety. And so that became something that I began to live with until it got progressively worse and I couldn't breathe. And it was slowly, I didn't know this, but now I understand my artery was slowly closing until I could not breathe.
Big sigh. Because, Dr. Underwood, we hear about all of the symptoms that Dr. Champagne just mentioned. We talked about how impactful stress is on our lives. We hear about, how impactful all of these issues regarding anxiety and mental health. How would she know that she was having a heart attack? Because based on the information that we are getting through the modern fire hose, those doctors may not have been wrong.
Well, it seems as if the doctors likely were wrong.
Yeah, we know. Yeah, and I say that, but just like, oh, it's anxiety because everybody has anxiety now, or
right?
It's stress because everybody has stress now.
Certainly. Well, the reason to go to an emergency room is to try to sort through that, to find a definitive answer and not just think about what it could be or what we would want it to be. I mean, oftentimes we want it to be stress. We'd want it to be something like upset stomach. Maybe it's something I ate. Oftentimes people will there's a list of things that they would rather have than be having a heart attack. And they often would want to say that their symptoms would be coming from that. But to get back to your point about what we should know is we should all know what the heart attack warning signs are, the symptoms. Just like we should all know pretty much in America that, we should not be eating high salt, high fat, high sugar foods. So there's a lot of education that has come about, but I think that it may not have been come about in a regularized way that all segments of the community take that message in. And so oftentimes we don't know, just as Dr. Yolanda was saying, with CPR in African-American communities, there is a lack of understanding how to perform that skill in Black communities. So we need more education in Black communities on heart and heart health type patterns. So that helps us. Now with the healthcare system, that's a different story because there's sometimes a stereotype that comes to play when you have young women presenting with what could be cardiac signs, because in our minds, perhaps the way that we've been raised in the medical education system, the U.S. medical education system, we think of perhaps like white men, businessmen having heart attacks because they're under the stress of doing business. And so you would see a young female and say, well, you can't have that much stress. And, this shouldn't be something that you would have. You probably have some form of anxiety. And why don't we just start treating you for that? So that's where sometimes bias comes in, particularly in healthcare institutions like emergency rooms, where decisions are made, and they can sometimes be made erroneously if they're not followed up and taken, like blood tests and electrocardiograms, to determine what actually is the cause of someone's symptoms.
So for the educated health consumer, Dr. Yolanda, when something like Dr. Champagne's experience happens, I mean, how do you advocate for yourself? And this is again the issue about health disparities and bias. Let us assume that there is a well-educated Black woman, middle class, who is trying to advocate for herself, and you trust your doctor to tell you the truth. I mean, if you're having any of these symptoms and you go to see your doctor, do you need to say, I need you to check to make sure I'm not having heart issues? Or do you listen because you believe your doctor knows best?
Okay, so I'm going to start with.
Go ahead and start with it.
The statement you first made was, let us assume that this is a well-educated Black. We don't have to assume. We are the most educated in the country, right?
Yeah, but hold on, but not everybody, because of disparities.
No.
And where they live, they don't always know. I'm trying to throw out the factors that could get in the way.
But what we're talking about is we've never had the conversation of not, are we just educated? We're not advocating. That was the word I wanted to get to, because that's what you said that I thought perfect, because that's the word that I'm always using with my patients. We're not advocating for ourselves in so many settings because we have been dismissed in every space, even when you are educated. And so what's happened with a lot of Black women is you've gotten used to knowing you know something. Your intuition tells you, all the signs and symptoms tells you, all of these things are telling you and you're screaming at you, but you're being told by society or whoever, or a physician or a doctor in a space, that's not what it is. And so for a long time, we kept accepting that. I do believe we've turned a page. I do believe we're starting to turn a corner. We're really talking about advocating for ourselves. I love this conversation because I often have to say to women, you know, Dr. Champagne stated, you know, we take care of all these other people. We're so used to taking care of everyone else. We don't take care of ourselves. What I love about pediatrics is mama bears and papa bears, they advocate for their kids, but sometimes they don't advocate for themselves. So I say to them, you have to do the same. Here's why I started having this conversation with adults about children. Our children, there's two parts to the conversation. They need us to be the examples for them. So what are we eating, right? How are we exercising? And they need us to be around long enough in their lives to grow up with us. So we have to advocate for ourselves. We need to be strong, healthy, eat right, and say, listen, something's not right. And if you, and I say this all the time, we work for you. The physicians, when you walk into a space, we're employed by you. You're paying our salaries. So if you don't hear what you think you need to hear, and you really believe there's something else going on, challenge them, not in a disrespectful way. Just say, you know what? I would appreciate if you would do a little bit more testing. And as Dr. Underwood said, there's bias that comes with that just says, you're kind of young. You can advocate for yourself and ask, but you need to know to ask, is there a possibility that I might be having a heart attack? Aren't there some enzymes that can be checked that would tell you if I'm having something very small and simple? That person goes, you know what, this person's a little bit more understanding. They're educated. I can go ahead and do that test for you. But if they don't bring it up and they're not thinking about it, it gets missed. So it is that bias that comes into play, but advocacy, you got to self-advocate. We work for you. We're partners with you in your health. So sometimes you got to hold us accountable.
Mm-hmm. I don't want to forget about the guys, Dr. Underwood, and the important question goes back to how heart attacks present between men and women. Why are they different?
Well, I mean, it's.
I mean, beyond the
we
obvious,
can certainly specify differences between between men and women, but why God actually put those differences there sometimes is difficult to know. Mm-hmm. But some things can be said, particularly about people's pain tolerances, right? And it seems that women may tolerate more pain, just as we said earlier, that they often will take care of everybody else before taking care of themselves. So it may be a significant pain in a man, and it's not quite as significant a pain in a woman. So that's one way of saying it. But just in general, there are certain symptoms that women may have, such as nausea and vomiting relating to heart disease, heart issues, that men just may not get. And the symptoms overall are variable. So we say chest pain as it's a short 2 words that we can use, but it's really like an oppressive sensation in your chest, or as Dr. Champagne said, it could be in your jaw. I've had some patients that have a strange feeling in their finger. You know, so there are areas where they are. The thing is, it's usually related to some form of exercise, right? If you're more active and your heart is pumping harder, then it hurts more. And then when you sit down and your heart is not pumping as hard, it tends to calm down. So that's a key point about either of those pains, whether it's in a man or a woman, that there oftentimes is some activity component to it. In terms of how people are wired and why someone has upset stomach, whereas someone else may have sweating or break out in a cold sweat, those are just differences of people, just as we're all different. But I think we do have to recognize that all the symptoms aren't just found in men, that, if we started including women in that symptomatology, that there would be a larger range of symptoms that people need to be aware of.
I guess what I'm asking, and again, I'm asking as a layperson, that, I mean, you just said, okay, if there's vomiting, how do I know that it just wasn't bad shrimp at the 5-star, and after you got served something bad, it's a 3-star restaurant?
Mhm.
You know what I mean? Okay, so because if somebody's listening to this conversation and a woman says, okay, I went out, had my shrimp dish, just enjoyed it, and then all of a sudden I get home and I'm vomiting, the first thing they're going to say is food poisoning.
Mhm.
Okay, so if I go to the doctor, does that mean that I say, look, I went to Joe's restaurant, had my dish, I ended up vomiting, I think it's food poisoning, but should I then say, could you check for the enzymes and make sure I'm not having a heart attack? And because I don't, this is an important thing, and I don't want people to be unnecessarily frightened while trying to be informed and advocate for themselves.
Mhm.
Okay, I'll start with, I think it speaks to patterns first.
Okay.
I think it's
Okay.
to understanding what your risk factors are, right? So this is why we're talking about all of the risk factors. If you know that your risk factors are obesity, if you know your risk factors are maybe you're a smoker or you've been a recent smoker and you just stopped, because again, the longer you stop, the more years you have not smoking, your risk of heart attack and heart disease goes down. I think it's a pack a year or something like that with each pack that you stop, or each year you stop smoking. I can't remember. You know this, Dr. Underwood, you can tell them, but it goes down. I'm a pediatrician, so I don't know all of that stuff. But you, so you got to know what your risk factors are. So if you're aware of what your risks are, then you're going to have a lower tolerance for certain things that happens to you, right? The second part is, now I think we're really starting to have conversations about in tune with your body. Something Dr. Champagne kept saying was, she just wasn't aware. She just wasn't paying attention. Who gets, and this is, respectfully, who gets ankle swelling and thinks it's normal? A person who doesn't think of what relationship their ankles really have to their body and their heart. I can get a hangnail and I'm like, okay, let me make sure I'm watching this to make sure it doesn't get infected, because I'm very aware of my body. So we're starting to give information that says, be aware of your body, understand what is associated with hearts. That's edema, right? That's shortness of breath. That's any pain in this area. Like you said, it doesn't have to just be your chest. It could be your arm. It could be your jaw. So we're giving more information. So I think that it's not just, did I have shrimp and did I get sick? What are the other things that am I always out of breath? Every time, am I having a hard time just getting up the stairs? I used to be able to get up the stairs, but now by the time I get to the top of the stairs, I am just wiped out. And when I get in the house, I have to lay down. That's progressive. It's been happening and you're not paying attention to it. So people's bodies are speaking to them. They're not listening. They're not listening. Our job, all three of us are here to constantly, we are trying to be that water hose of information, because something's going to sprinkle on you that you remember, wait, they did say that maybe, I could have tingling in my hand and it could be something. They did say, but it's a pattern. It's not the one thing that happens to you.
Mm-hmm. And that's really important, because that's the thing that I was really getting to, and you really put it succinctly, because you don't want to have something happen and you think that you have heart disease or you're going to have a heart attack. If you stumble over your dog walking in the house and you fall, don't just jump to conclusions, but as you said, pay attention to all things and patterns to make sure that nothing is missed. Dr. Champagne, outside of your advocacy, how has your life changed since your heart attack?
Well, I do a lot of speaking engagements now.
Right, and I want to stop you right there, because what I want to know is how has
physically,
your life? Yeah, I want to talk about how you see yourself. I said outside of your advocacy,
Okay.
Because that is the thing that is so important and a message for everyone when they have survived this.
Okay. So physically, health wise, on a journey of losing weight with
Okay.
diet and exercise, and having more of a plant based diet. To be honest with you, so I'm monitored, and my cholesterol levels fluctuates. So got to make sure we keep that cholesterol level down and drinking more water. And you can exercise on YouTube. So, I do things as I can and make sure that I'm being checked regularly. And I'm pleased to report I've been able to come off of at least one of my blood pressure medications due to my diet and the change in lifestyle. But I did want to interject something that Dr. Yolanda was saying about educating people and making sure that when they do talk to their healthcare providers, they can ask, could this be heart related? Or I have some of the risk factors for heart disease in my family. Therefore, can you test for that? So I was not educated before, but I do, as I do support groups, let people know, you have to push the doctors a little bit and ask them for, is there another type of screening you can give me? Because, high blood pressure runs in my family or something like that. But saying the words heart attack, heart disease, while you're at the doctor's office puts another spin on it because you could be asymptomatic. And one of the things we're pushing for is for legislation to be passed to make cardiac screenings an annual part of your physical exam, just like breast cancer screenings in women are. So you could be asymptomatic, but having some of the risk factors like high blood pressure, diabetes, and high cholesterol and family history should justify getting a cardiac screening.
Yeah, I think that's a great place to end this conversation. It is so important to educate and to advocate. Dr. Champagne, we also should say, and I think the technical term is Black don't crack for you, because you look the same as you've looked, all over the many years that I have interviewed you, and I'm so glad that you continue in good health. And it's good to see you.
Thank you. You too.
Yeah, Dr. Yolanda, also, thank you so much for your work. And also, Dr. Underwood, I really appreciate your time and that we could have a real rigorous conversation to let people know the seriousness of this and to make sure that they are taking care of themselves. Thank you all so very much. I appreciate your time.
Thank you for having us.
Thank you.
Sure, absolutely.
All right.
That is the Daily Drum for this Wednesday, February 19th. I'm Harold Fisher. Good night.